lateral column. There are a few small tracts also present. The names are very easy. Spino-olivary tract. Spino-olivary. When I'm saying spino-olivary, where is it starting and where is it going? To? Very simple. Olivary. The term olivary, are you familiar with? Not yet, I believe, because you haven't done the brainstem. In the medulla, there are olivary nuclei, superior inferior olivary nucleus, special olive shaped, okay, like shape of zaitun, typical olive. The term is olivary, okay. So these olivary nuclei are present, and the tract is going to the olivary nucleus. Is that clear? Okay. Then spino-reticular tract. Spino-reticular. What do you mean by spino-reticular? We are just dissecting the names only, yeah. But starting from spinal cord and finishing up somewhere in the brain. Which part of the brain? Reticular formation. Reticular formation is a fascinating network of the nerve fibers and the nerve cells, a loose network, okay, interlacing network, which is mojood in the center of the brain stem. Shabab, I am using the word brain stem. Are we familiar with the word brain stem? Okay, midbrain, pons and medulla, like a stem of the shajar, like this. So the upper part of the brain is like expanded part of the shajar, and the stem is supporting part. This stem is made up of three things, you know that. It starts from the midbrain and then into the pons and then medulla, okay. Inside the center of this brainstem there is a loose network, okay. The remaining part is very tight, solid. It is white matter and gray matter, but in the center there is a loose network. It's kind of a gray matter but very loose kind of interlacing fibers and nerve cells, and that extending column, longitudinal column, is called the reticular formation, and that has very special functions, okay. If a tract is starting from spinal cord and it is going to the reticular formation finishing there, what will you call this tract as? Spino-reticular tract. Are we clear about that? Okay. Spinotectal tract. Spinotectal. Spinotectal. Spinal, easy. Tectal means definitely you are guessing about some part of the brain, okay. Tectum. Tectum. Tectum is a part of the midbrain, okay. If a tract is starting from tectum, from the spinal cord, and it is going to the tectum part of the midbrain, what will you call this tract? As spinotectal tract, okay. Spino-vestibular. Spinal cord, there is a group of, no, you have not done it right now. You have not done equilibrium. You will do it in special senses. Vestibular nuclei. Vestibular nuclei is a complex of nuclei, four nuclei, which are present in the medulla and slightly extending into the pons, medulla, okay. Vestibular nuclei. So if tract is beginning from spinal cord and going to the vestibular nuclei of the brain in the medulla, spino-vestibular. So very easy names. Spino-vestibular, yani to vestibular nuclei. Spino-reticular to the reticular formation. Spino-olivary to the olivary nucleus. Spinotectal to the tectum of the midbrain, like this. These are the names. Is it okay? The names are fine? Are you getting that? Okay. All right. Now, very quickly, let us talk about the functions, please. Functions of these tracts, okay. Before that, this is another view showing you different tracts and arrangements. Even minor tracts are shown. We have not discussed the minor tracts, which are interconnecting the few segments. That is all right. Tract of Lezoyer and septomarginal fasciculus, small terms, not really important. We are concerned with the major tracts of the spinal cord, okay. Ascending pathways. All right. General discussion. Number one, sensations which are going up, they reach your level of consciousness. What is your level of consciousness, by the way? Cortex. Cerebral cortex is a perfect term. Thank you very much. You understand everything, you appreciate everything, you decipher everything, you get the meaning of those things which are reaching your cortex. It's a level of your shaur. Okay? You understand. Your awareness is there, your understanding is there, and that is cerebral cortex. Okay? So the conscious level is the level of your cortex in the brain. Okay? Some sensations are reaching cortex, and those sensations which are reaching cortex, they are being appreciated by you and you understand them very well. There are some sensations which are subconscious. They are there, but you don't know about them. Can you give an example of that sensation?
Subconscious.
Subconscious?
For example, breathing control.
Okay, breathing control or bowel movements. Okay, bowel movements, yes, to one extent, yes. Okay, but some part of the bowel movement can be sensed by us also. Okay, at times when it is distending or stretching, then we have a feeling also, and that gives us a desire for defecation or urination. Okay, or the desire to vomit things. Really, when we have a feeling of fullness or sensation of distension also. You know that in the GIT. Okay, it happens. You have done it. But yes, there are subconsciously activities going on which your system, your nervous system knows about, but you don't know at your level of shaur. You don't know about that. You're right. I agree with you. Okay, respiratory movements or some other examples. Heart rate. Do you know about your heart rate? At what point it is changing from 70 to 75 or 75 to 80 or 75 to 60 or 75 to... It may become palpitation, and sometimes you feel it duck, 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 duck when you are anxious or you are doing exercise or you have done some activity or emotions, but otherwise you don't feel it. Your heart rate. Do you feel your blood pressure changes? You don't. Okay, so there are many conscious sensations which are happening and you don't feel that. Okay, likewise there are some sensations in your muscles and joints also. We'll discuss that. They are subconscious. Okay, so subconscious means your brain is appreciating, some areas of your brain are receiving those sensations and controlling, doing something, but you don't know about that. Okay, that area is subconscious level. So some of your subconscious sensations are definitely there. Please. Affective means some of the impulses, sensory impulses, take the pathway to emotions. Okay, our emotions, affective behavior. We have different types of emotions, positive and negative emotions, definitely. We'll talk about that, inshallah. So there are some sensations which are belonging to our emotional system. They're traveling to the emotions and they give rise to emotions, and we show or manifest the emotions also. So we divide into three basic categories: conscious, subconscious and affective. Affective means related to emotions. Okay? Conscious are projecting to the cortex, we know that. Okay? They are passing through the thalamus and they are going to the cortex. Subconscious, they are not going to the cortex or not appreciated by the cortex, level below the cortex, maybe somewhere in the midbrain or in the hindbrain, somewhere in this region of, but not going to the cortex level where you understand those sensations. Okay? They are definitely going to lower areas of the brain, but not to the cerebral cortex. I'm talking about subconscious. Okay? All right. Emotional, behavior changes, excitement, these pathways are also going up in some areas of the forebrain, midbrain and hindbrain. All areas they are going. We'll have a separate discussion about. Right now we are not discussing this because we have a separate lecture about the limbic system and we'll deal with those areas, inshallah. Okay? We are talking about, first of all, we must know about the simple things which are very important. Somatic pathways, the main pathways of your sensations. Your sensations. I think you have started doing sensations, right? Not yet? Okay. But you have done the nerve fibers or the nerves? You have done it. You have done the receptors, which carry different sensations. So you are familiar with the names of sensations, I am sure. Touch, pain, temperature, pressure, like this. Okay? These sensations, you know the names of the sensations if you have not done them. Alright? Okay. Now, functionally we divide our main pathways or main sensations into three groups. One group of sensations is carried by the posterior column or the dorsal column. Remember the dorsal column? Fasciculus, gracilis and cuneatus. Well, that takes one pathway, functional pathway. Halas, one. Okay. Now into the ventrolateral system, anterolateral system. I talked about the spinothalamic system. Do you remember that? That is one major system taking the impulses. And the second one is spinocerebellar pathway. Okay? Yes. Remember again another system, anterior and posterior. That forms another system. These are the three main pathways. The other tracts are the small tracts having some little functions. But mainly and as a priority you will begin with these three major systems. Dorsal column system, the spinothalamic pathway system, and the spinocerebellar pathway. One by one, let us get started. And now it's time to have physiology, please. Okay? The posterior column or the dorsal column, please. Okay? I'll just show you the pathway. Okay? Look at this one, please. I'm starting the picture. What are you viewing in the slide? I'm starting. What do you see on this side? Receptor. You know sensations begin with, you know that. Okay? Then they have to travel. Receptors could be modular in the skin or the deeper tissues. It's not necessary that they're present in the skin. Here we have shown skin. It's okay. But it could be in the muscle, tendon, joints, deeper tissues, viscera, anywhere in the body. Inside levels or most superficial level, the receptors are all modular. Okay? The number and density distribution, it changes, but they are present everywhere. Okay? Alright, receptors. So we are starting the pathway. The sensory fiber is going from the receptor now. Okay? Look. So receptor will initiate the origin of the impulse, and the impulse will now, sensory impulse will travel in the sensory fiber. Alright? Afferent fiber. Do you agree with that? Are you here with the diagram?
Yes, sir.
I have doubts. I'm sorry. Okay. Now, the sensory fiber is going close to the spinal cord, and outside the spinal cord there is a specific ganglion module in the posterior root. You know that. It's called the dorsal root ganglion. Have you seen that? Alright. So this fiber is entering into the dorsal root ganglion. Dorsal root ganglion has special neurons, very special neurons. What kind of neurons are these? Yes. Now I am getting two words. I have to be very clear about that. Is it unipolar or pseudo-unipolar? Yeah, the better term is pseudo-unipolar. Unipolar typically means when you are having a neuron or the cell body and only one pole or one process is passing out, khalas, you call it unipolar, wahid. Okay? But if this process comes out and quickly divides into two processes, then it appears initially the unipolar, and then it is confusing. It is dividing into two long processes. So you can't call it bipolar, you can't call it unipolar purely. You have to choose the word pseudo-unipolar, seemingly like unipolar, but not really, isn't it? So it's a type of the unipolar, and this is the pseudo-unipolar neurons. Okay? All right. Outside the CNS in the dorsal root ganglion. Okay. It's also shown here, module outside in the dorsal root ganglion here. Okay? Now please look at the picture. I want you to be clear about the picture. Pseudo unipolar neuron, one neuron is shown here. What is the behavior of this neuron? How many processes does it have? Initially one process, which is dividing into two. One process is going where and other process is going where? One is peripheral, another is? Thank you. And these are the true names of these processes, okay? A peripheral process belongs to the receptor. The central process goes into the spinal cord. So don't call it axon and dendrite. Use the correct term, the peripheral process and the central process. So the peripheral process is coming from receptor and the central process is going to the center, yani spinal cord. All right, are you getting this? Okay, I hope you are clear about this one. Okay, you are starting from periphery here. So this process should be peripheral process. This is peripheral process. This process is central process. All right, now we are about to enter into the spinal cord. Okay, do you see that?
Yes.
Now the process has entered into the spinal cord. Well, this neuron is the first neuron of the pathway. Do you agree with that?
Yes.
This neuron cell is the first cell of the pathway. Yes or no? Receptor is only the division of this fiber, a special modification of this fiber. Receptor is not a cell, separate cell, okay? All right? So what do you think? This cell body or this cell is the first awwal neuron of the pathway. Yes or no? You call it the first order neuron of the pathway. What do you call it? First order neuron. Bit tartib, the first one is this one. So you call it the first order neuron or the primary neuron of the pathway, sensory pathway, the first neuron. So the first neuron of the pathway is present outside the CNS or inside the CNS? Yes, that's great. Okay, so the first thing is outside. Are we all clear about that? Okay. Now, we are talking about second order neuron. The fiber has entered centrally, all right? Okay. Now you see another neuron cell body which is present in the spinal cord. Okay, it could be spinal cord or this could be present in the brain also. Okay, please, there are two possibilities. The second order neuron, it may be present in the spinal cord or it may be present in the brain. If it is in the spinal cord, then the fiber will easily connect, no problem. Okay? If it is in the brain, then the fiber has to travel all the way to the brain and then it will synapse. You know the meaning of synapse? Yes. Okay. Okay. All right. Outside the central nervous system, did you see any synapse in the picture? Answer me. Abdullah, you are saying yes. Listen to my question again. Outside the central nervous system, outside CNS, did you see any synapse in the pathway? Was there any synapse in the pathway outside? In the dorsal ganglion, is there any synapse? No, it's not synapse. It's the distribution of the fiber, no synapse. It's the Wahid cell mojood, no synapse. Okay? The first synapse is present in the spinal cord or in the brain. It depends really. Yes, exactly. The first synapse, this is the first synapse, this is the first connection, isn't it? So awwal synapse is present in the spinal cord, yeah, where the first order fiber is meeting with the second order neuron. This is second order neuron cell body. All right? Okay. What is happening? If it is the spinal cord level or even at the brain level, after synapsing, usually what happens? The axon or the fiber of the second order neuron, what is it doing? It is crossing over to the opposite side in the spinal cord or mumkin in the brain also. It does the same thing. Okay? Crossing over. It's passing to the opposite side and now it will pass up and ascend. Okay? Please, this is very important. The first order neuron fiber which comes inside, okay, Does it synapse on the same side or the opposite side? Same side. But after synapse, the second order neuron fibers, usually, does it go to the opposite side or the same side? It is also a possibility that some fibers go on the same side. You will see this possibility also. But mainly what happens, they cross over to the opposite side and they ascend. Okay? All right. Crossing over. This phenomenon of crossing over in the spinal cord could be in the brain. Now you are going up to a specific level of the thalamus. Thalamus is a big station. All sensations have to stay at the level of the thalamus. Okay? Laziman, all sensations will stop. So this fiber will stop in the thalamus. Okay, let us see what happens next. Now, in the thalamus, do you see any synapse? Yes. All right. In the thalamus, you saw the synapse. Is it the first synapse or the second synapse of the pathway? In the thalamus, do you have the second order neuron or the third order neuron? Oh yes, the third order neuron of the pathway, but the second synapse of the pathway. All right? You're getting it? Is it the thalamus of the same side or the thalamus of the opposite side where the fiber entered? Opposite side, because crossing over has already done. Okay? It's now the opposite side of the body, thalamus of the opposite side. Okay? From the thalamus of the opposite side, now the third order neuron fiber is going up. When it is going up, it is going to the cortex, your highest level of understanding. Is it going to the same side of the cortex where the thalamus is موجود or the opposite side of the cortex? Same side of the cortex. Okay? All right. Now I rephrase my question. A sensation from one side in this diagram, is it going to the opposite side of the cortex or the same side of the cortex? Opposite side of the cortex. You got it. Thank you very much. Okay? So, now you use the term first order neuron. Do you understand the meaning? Second order neuron, do you know where it is and what is the meaning? Okay, give me the two possible levels of the second order neuron, spinal cord or the brain stem or the brain somewhere. Okay, third order neuron, definite level, thalamus. Okay, and finally Markaz is the cortex, the center, highest center is the cortex. Okay, what is the primary neuron in the pathway? Dorsal root ganglion. Primary. Now I'm changing the terms. I'm just trying to trap you using another words. Primary neuron of the pathway, you will say dorsal root ganglion. Where is the secondary neuron of the pathway? Spinal cord or the? Where is the tertiary neuron of the pathway? All right. And where is the final receiving neuron of the pathway in the Markaz? In the cortex. Did you get that? All right. Okay. So how many synapses do you see in this pathway? Two. How many order neurons bil tartib do you see in this pathway? Three order neurons. So it's a three order neuron pathway having two synapses usually. Simply, this is like this. A sensory pathway typically is a three order neuron pathway if it is going to the cortex and it has two synaptic junctions. Am I clear? Okay.
Doctor,
Yes, please.
where is the first neuron?
Neuron avval, number one.
Outside.
Outside. Now, let us put it, thank you very much for question. How many neurons in the pathway are present inside, the cell bodies are present inside the CNS? Two. And how many neuron cell bodies are present outside the CNS? Wahid. Okay. The very first one is موجود outside. The other two are موجود inside the CNS. In many ways you can describe your pathway. Okay. In many ways you can describe your pathway. Really. As many ways as you want, really. Okay? All right. So we are clear about this pathway, the basic framework of the pathway, how a sensory pathway goes up. Okay? If it is reaching at the level of the consciousness. Okay? Same thing which we have done. All right. This is a typical pathway which is no, I'll show you another pathway. Let us have a comparison now, please. Okay, Shabab. Tell me one thing. There are two main systems which are present in the spinal cord, I told you. Okay, ventrolateral column and the dorsal column system. Okay, in the ventral or the ventrolateral column, we said that we'll talk about two main pathways: spinothalamic pathways and spinocerebellar pathways. All right. Okay, we are considering them now. Let us see. And even out of the anterolateral or the ventrolateral system, the main representative pathway is a spinothalamic pathway. The main one is spinothalamic. We will also talk about the spinocerebellar pathway, which is important, but that's simple. Okay? The main pathway, representative pathway, is spinothalamic. So dorsal column system and the spinothalamic system, these are the two comparative systems that we will discuss. One side you have dorsal column medial lemniscal pathway, and the other one is spinothalamic pathway. Okay? All right. Now please see. Look at the pathway of, first you talk about the dorsal column pathway. Get a clear concept of the dorsal column. We'll discuss, we'll have questions. When we are clear, we'll talk about the functions. Okay? But you have to be very clear about that. First thing you see, the diagram is kind of different in the sense that it is not the same diagram that we saw previously. It is slightly different, but you need to understand the difference really. Okay? Dorsal root axon, it's coming from here. Dorsal root is موجود here, it is not shown here, but imagine dorsal root ganglion is present here. What type of cell is present here? Pseudo-unipolar. This process is coming into the spinal cord. So is it a central process or the peripheral process? Central process. Peripheral is not shown, ganglion is not shown, khalas, no problem. Okay, but we know that what is coming inside is central process which is coming in. Now this central process after coming, okay, now this is something new and confusing. You see, what is this? We don't understand that, okay? This process is dividing into two. One branch is a tawil branch, can you see that? And one is a short branch really, a short fiber. Okay? The short fiber goes into the spinal cord and it connects or gives message to some local neurons of the spinal cord, but it is for the reflexes or for the coordination basically. Even if you don't consider this one, this is the main thing which is going really. Okay? Now you forget it. Don't get confused with this one. It's only a little connection or information which is going into the spinal cord. Khalas. So forget it. Okay? Consider this one. What is happening in the dorsal column system? After entering the central process, what does it do? Going up. Passing in the spine. Is it synapsing in the spinal cord? This one, this process. I'm not talking about this little part. Leave it. Okay? I'm talking about the main process which is going up. Is it synapsing in the spinal cord? No. It's passing in the medulla. Okay? In the medulla. In the medulla, it is synapsing in the nucleus. Okay? This area. This is the nucleus here. This nucleus could be nucleus gracilis, or this nucleus could be nucleus cuneatus. Okay? Both are collectively shown here. Okay? It's a majmua you can consider. Gracilis or cuneatus. You are showing just one fiber for example. Okay? So it is going to the nucleus gracilis or cuneatus. Is it synapsing in that nucleus? Yes or no? Yes. Yes. Is it the first synapse of the pathway? Yes or no? Yes. So the synapse has not occurred in the spinal cord. The synapse for the first time has occurred in the medulla. Alright? After synapsing, what is happening? Okay, so it means the first order neuron of this pathway is موجود outside dorsal root ganglion. Same. The second order neuron of this pathway موجود in spinal cord? No. It's موجود in the medulla, the brain. Okay? Nucleus gracilis or cuneatus, second order neuron. First synapse is happening there. After, from the second order neuron fiber, what is it doing? Crossing over to the opposite side in the brain now and it's traveling up. What is next? Where is it going? Thalamus. Is it synapsing in the thalamus? Yes. So it means the third order neuron is موجود in the thalamus, and the second synapse of the pathway is also موجود in the thalamus. Second synapse, okay, in the thalamus. Third order neuron